For the next oral presentation entitled Curcumin-Encapsulated Cell-Derived Nanovesicles, targeting the 3R strategy, remove, remodel, and repair for Alzheimer's disease therapy, presented by Yuankai Gu from Naval Medical University.
Okay, good morning, respected professors, fellow researchers, and dear medical students. I'm Yuankai Gu, an undergraduate student from Naval Medical University, China. On behalf of my co-authors and research team, I'd like to express my sincere gratitude to the conference committee for offering this precious opportunity to share our work. Today, I'll present a novel nanomedicine strategy for Alzheimer's disease therapy, integrating neuropharmacology and nanomaterials under the theme of sustainable healthcare, targeting the 3R strategy: remove, remodel, repair for AD. First, let's underscore why AD demands urgent innovation. As the most prevalent neurodegenerative disorder, AD affects more than 35 million people globally, with annual costs exceeding $1 trillion, and cases are projected to triple by 2050. However, current treatment falls short. Cholesterol inhibitors only alleviate symptoms temporarily, while FDA-approved anti-A-beta monoclonal antibodies, lenacanap, show limited efficacy and safety concerns. Curcumin, a natural compound with remarkable anti-aging and anti-inflammatory properties, is like a talented but underutilized candidate for AD treatment. Its potential is undeniable, yet poor bioavailability and blood-brain barrier penetration hold it back. So we ask, can we equip curcumin with a brain-targeted therapy symptom to unlock its therapeutic power via the 3R strategy? Before diving in, let's get to know a key overlooked driver, aging-related microglial senescence. We did a bioinformatics analysis of GL datasets, finding senescent microglia amplify neuroinflammation, worsening A-beta plaques and tau hyperphosphorylation, creating a vicious cycle. To break this, the 3R strategy: remove senescent cells, remodel neural inflammation, repair neuronal damage was proposed. Curcumin fits this paradigm perfectly, but its pharmacokinetic flaws block clinical translation. This unmet need is what our study aims to address. Our core aim is straightforward: engineer brain-targeted curcumin-loaded nanovesicles and validate their efficacy via the 3R strategy in AD models. We hypothesize 3 key points. First, and recur could enhance curcumin's solubility, stability, and BBB penetration. Second, it would systematically execute these 3R steps to mitigate AD pathology. Third, it would maintain favorable biosafety or potential clinical translation. To test this hypothesis, we designed 3 key experimental components. First, and recur preparation. We use a top-down extrusion method to fabricate nanovesicles, B16MVs from B16 melanoma cells, known for BBB tropism, then loaded curcumin via silication. To qualify the critical properties, we utilize standardized methods, size and zeta potential by DOS, morphology by TEM and BCA assay. We also validated its stability and in vitro release function. Second, in vitro validation, we induced senescence in BV2 microglia and NV2 neurons with hydrogen peroxide, then treated them with free curcumin or recur with equivalent curcumin to assess senescence, inflammation, and protein expression. Third, in vivo experiments, 15 or 16 months old 3TG mice received 15 intraperitoneal injections of recur over 45 days will be evaluated BBB penetration, pathology, cognition, and biosafety. Let's walk through our key findings page by page. First, recur is a high-performance nanocarrier, the foundation of our therapy. As shown, B16 MVs achieve 3-fold greater brain accumulation than other common types of MV, mediated by CD44 and V6-dependent transcytosis. The extrusion method yields 18.8% more NV protein than conventional isolation, with NV curve showing uniform size and stable zeta potential. NV curve achieves 5 times more curcumin retention at 8 hours and significantly reduces cytotoxicity. About this 3R strategy in action, first, let's look at the remove part. Curcumin and MV curve effectively eliminate senescent cells, particularly senescent microglia, both in vitro and in vivo, breaking the pathological cycle of AD through the remove step of the 3R strategy. MV curve reduces cortical P16 plus senescent microglia by 30 to 40% in AD mice. In vitro, it's a big scale thinning showing great reduction in senescent BV2 cells and N2A neurons with 45 lower P16 protein and fewer CD1 beta plus activated microglia. Then the remodel part recur effectively suppresses neural inflammation by inhibiting senescence-associated secretory phenotype factors, executing the remodel step of this 3R strategy to break the pathological cycle of AD, breaking the neural inflammation cycle. Finally, the repair part recur effectively reverses AD pathology, repairs neuronal damage, and restores cognitive function, completing the repair step of the 3R strategy for comprehensive AD therapy. And recur reduces cortical A-beta plaques by 50% and hippocampal p-tau by 40%, while increasing hippocampal neuron density by around 48%. Cognitively, it greatly boosts white-maze spontaneous alternation rate, novel arm inch rates, and Nest-joint scores. This data directly confirms functional recovery. In total, 3 parts synergistically attack on AD pathogenesis. The 3R strategies addresses multiple aspects of AD pathology simultaneously, providing a comprehensive therapeutic approach. Finally, biosafety is guaranteed. No significant changes in body weight, liver or kidney function, or organ histology, even curcumin reported, is avoided. To summarize, Recur is mechanistically innovative medicine that historically treats AD via the 3R strategy. Thank you all for attention. I'm now happy to take any questions.
Thank you for the interesting topic. Do you have any comments or any questions?
So I have one question about what is the mechanism of the curcumin to improve the Alzheimer?
We have just concluded that by 3R, remove, remodel, and repair, since it's an anti-inflammatory, and since this, it can solve many problems, and the nanoparticles improve its effect in many ways. Okay.
Thank you for the interesting topic.